Hello everyone and welcome to my second presentation on physical therapy interventions. My selected intervention is TheraTogs, and this is relatively a new intervention strategy, and I'm going to talk about this today. TheraTogs are said to be live-in exomuscular system. They are basically orthotic undergarments and strapping systems that give the children or any other client sensory motor input, and it works on the biomechanical and the neuromuscular principles, thus helping the person. However, it should not be compared or confused with a SPO, which is a stabilizing pressure input orthosis, because SPO does not give the sensory input the way TheraTogs give, nor does it have extra external straps to activate, inhibit, or maintain a muscle in a particular position. As you can see from the picture that it is kind of a sleeveless swimsuit, but an elastic swimsuit. It is really easy to wear, and you can see that it is washroom friendly for children, because few children do not have control over their bladder and parents need to change their diapers, and it is very accessible. They are also present in approximate sizes depending upon the weight of the children. Like infants from 15 to 25 pounds have different sizes. Preschool boys and girls from 25 to 45 pounds. Then pediatric, petite adults, small adult females, medium adult females, and large adult females. And to talk about the history of TheraTogs, the idea was of Beverly Cusick Billy. She was a pediatric therapist and she was practicing since 35 years. And as most of us have always thought that 1 hour therapy session is never enough for our children, and we feel that we can just cut off our hands and send it with the child so that he gets the continuous stimulation and the activation of muscles while he is at home. With that intention, she developed TheraTogs. So the target population had always been children. She called TheraTogs as the wearable hugs, which are the foam-lined inner hugging garments. They are elasticized, they are latex-free, they are breathable, they have a Velcro-sensitive external skin where the straps are attached, which is also called as the exoskeleton of the TheraTogs. Basically, she developed the company name TheraTogs with the help of her husband Lee Taylor, who is presently the company president. And the first production came out in 2002 after 5 years, and till now they have been a rise in the production of and the demand of TheraTogs, and the profit margins or the demand has reached up to $1.5 million. Pediatric therapists from the past used to use kinesio tapes, orthopedic tapes, or garments to, like SPOs, to make the children have the input or the so-called artificial hands at home, so that the improvements can be maintained and the carryover may be seen during the next session. However, this fell short of it, and this led to the development of TheraTogs. The following are the uses of the TheraTogs. They are used for postural corrections, neuromuscular difficulties, to improve balance, gait, movements, provide joint stability and increase body awareness, promote optimum bone and joint development. They also reduce the postural correction workload that is expected from an AFO. They improve motor performance during the therapy, and also After, when it is worn at home, it continues to maintain the motor performance achieved. So we can see the carryover effect in the next session, and even long-term effects have been seen. So, in short, it is like sending the therapist's hands home in support of the therapy program between the sessions, and this is what Beverly wanted to achieve. This picture shows a child wearing the TheraTog and using the 4-point canes and maintaining a standing balance. Um, TheraTogs have been useful to treat many children. They first initially started with the children in the area or the state of Colorado. However, soon they spread to a population of 30,000 patients over a period of 12 years. It has reached many nations and the distribution is now worldwide. Um the distributions are made over in more than 20 countries, and nowadays pediatric therapists are suggesting TheraTogs to most of their patients. This product received FDA's approval as a class 1 exempt product, so every batch of the TheraTogs does not need to undergo a clinical trial validation. Hence, the product reaches the market very soon, and that's how it helped in the production and increasing of the demand of this product. And now the uh, profit margins have reached $1.5 million for the company of TheraTogs. Beverly wanted to make this TheraTox treatment as one of the standard of cares for neuromotor dysfunction. She did not want it to be used as an assistive or a palliative treatment or simply for support. However, at this moment, it is used as an adjunct therapy, and it's still new and needs to be explored. Um, there are very few evidences available on this, and it needs to be explored in depth. If by evidence it is shown that it can train a child out of the dysfunction or prevent any compensatory dysfunctions, then it may follow the path to become a standard of care. The few really good features of TheraTogs are that they are foam lined, composite fabrics, they are elasticized, latex free, and like they are the ones which are primarily used for insulating electrodes. However, they readily ventilate the body heat and moisture. They are made up of the materials named New Stim and Pro Wrap. They are characterized by strong gripping abilities, they are thin, and best part is they are hand washable. As I also said that they have a toilet access, plus the vertical resistance in this flexible material supports the posture, and the horizontal elasticity fits any size. Yet you can develop custom sizes. They have versatile designs and colors. I have shown most of the pictures with blue TheraTogs. However, colors like skin colored, cream colored, pink colored, and orange colored TheraTogs are also available. The hipsters and the ankle straps are can be made unilateral or bilateral, and there are many adaptable straps. This picture that they are thumb and wrist units, forearm wraps, stretching wraps, split wraps are used morely on the trunk and the spine. And I feel this is how the TheraTogs Ultra full body system overall composes of these items. See the picture of the TheraTogs Ultra full body system, and how the child's posture and activity, especially the motor activity, shows improvement. To look at few evidences, I just got 3 evidences, and those are not level 1 evidences. There is only one RCT which is done on stroke patients, while the other two are just single subject designs. This single subject design is to show the effect of TheraTogs on gait and function of a child with spastic diplegic cerebral palsy. She was a 7-year-old girl. She was made to wear the TheraTog for 6 consecutive hours for 3 weeks. The cadence, velocity, stride length, degrees of toe in and toe out, and the GMFM scores were collected. Of the study, the positive findings showed that the cadence, velocity, right toe in and out during the intervention, and the carryover effect at home after the 1 hour therapy was really good, or statistically significant. They showed decreased gait variability after the 3-week period, like the carryover effect was really good. The GMFM scores improved from baseline to the carryover, like at 3 weeks, from 85% to 92%, while they increased from 81% to 86% in the components of walking, running, and jumping. However, no changes were seen in the stride length and the left toe in and out. This one picture shows how the therapist works with the child wearing the TheraTog, and how easy it becomes for the therapist as the child is aware of his body, or made to be aware of his body with the help of the feedback given by the TheraTog, and the therapist can actually work on the functions and the alignment, and see the improvement during the session, and hope that this improvement will show or have some carryover effect by the time the child comes for the next session. The second evidence is by Richards et al. The study was done in 2012. They compared TheraTogs and twister cables for in-towing during gait in child with spina bifida. This was again a single subject study. She was a 2-year-old female with L4 spina bifida and bilateral in-towing. 6 weeks of TheraTog therapy was given, and then 6 weeks of twister cables were used. 90-minute gait analysis was done for every week to compare the effects. When TheraTogs were worn, they were worn for 8 to 10 hours a day. Twister cables showed improvement in optimal foot progression by affecting the rotation of the leg, while TheraTogs also showed improvement in optimal foot progression but by external rotation of the hips. The gait velocity improved with TheraTogs, however the stride length was improved with the twister cables. But parents were satisfied and they preferred TheraTogs over twister cables. Parents find it really easy to make the child wear the TheraTogs as they are warm, comforting. They are not scratchy or really hard on the skin of the child, and they are toilet accessible. That is the main thing any parent prefers in their child. This randomized controlled trial by Magyar et al. In 2012 was a multi-centered, single-blinded study with 120 acute stroke cases. This was an adult study, and adults with functional ambulation category 3 were taken in the study. TheraTogs were basically used, and straps were used to help activate the hip extensors and the abductor musculatures, and they were compared to another group who used the standard level cane at the radial styloid process level. The intervention was for 5 weeks or till the patient reaches functional ambulation category 5. Data was taken at baseline after the surface EMG of gluteus maximus and medius muscles, after 3 months, after 6 months, and after 2 years. Yes, both the groups were observed for the longitudinal period of 2 years. There are a lot of outcome measures which are used. Few of them are the timed up and go, the temporospatial gait parameters, the dynamic balance was checked, and the stroke impact scale score was also used. Um, there were no significant changes over the period of time in the use of both TheraTogs and the cane. Improvement was shown in the functional aspect by the stroke impact scale scores. However, they observed that the gluteus medius contraction improved by 16.5% when the adults with stroke were using the TheraTogs, and it also showed a carryover effect. However, when they were using the cane, they were taking support of an additional device and they were not recruiting their muscles, and gluteus medius contraction actually showed a reduction of 22%. So the authors said that if TheraTogs are used and if muscles are getting recruited and used, then that might be clinically preferred assistive device. These are the few references which I have used for my presentation. And thank you very much.